Certainly. Calcium channel blockers, CCBs, are a class of medications that primarily affect calcium channels in various cells, particularly in the heart and blood vessels. They are commonly used to treat conditions such as hypertension, high blood pressure, angina, chest pain, and certain arrhythmias, irregular heart rhythms. Here's a detailed note on calcium channel blockers, including their types and functions. Types of calcium channel blockers. Dihydropyridine CCBs. These are the most common type of calcium channel blockers. Examples include amlodipine, nifedipine, and felodipine. They primarily target calcium channels in smooth muscle cells of blood vessels and are more selective for vascular effects. Dihydropyridine CCBs are often used to treat hypertension and angina. Non-Dihydropyridine CCBs. This group includes verapamil and diltiazem. They have a more pronounced effect on the heart's calcium channels. Non-dihydropyridine CCBs are used to treat arrhythmias and angina, and they can also help lower blood pressure. Functions of calcium channel blockers. Vasodilation. CCBs reduce the entry of calcium into smooth muscle cells lining blood vessels. This causes the muscle to relax, leading to vasodilation, widening of blood vessels. Vasodilation decreases peripheral resistance, which lowers blood pressure. It is the primary mechanism of action for dihydropyridine CCBs used in hypertension treatment. Non-dihydropyridine CCBs, verapamil and diltiazem, have a significant impact on the heart's calcium channels. By blocking these channels, they reduce the influx of calcium into cardiac muscle cells. This results in a negative inotropic effect, meaning the force of heart contractions is reduced. It's beneficial for treating certain arrhythmias, e.g. atrial fibrillation, and angina by reducing the heart's oxygen demand. Heart rate control. Both dihydropyridine and non-dihydropyridine CCBs can affect the heart rate. Non-dihydropyridine CCBs are particularly effective at slowing down the heart rate, negative chronotropic effect, which is valuable in treating arrhythmias. Dihydropyridine CCBs may have less pronounced effects on heart rate. Angina management. CCBs, especially those with negative inotropic effects like verapamil and diltiazem, are used to manage angina pectoris. They reduce the heart's oxygen demand and help relieve chest pain associated with angina. Arrhythmia treatment. Non-dihydropyridine CCBs, verapamil, and diltiazem are used to manage certain arrhythmias, particularly those involving the atria, e.g. atrial fibrillation, and to control the ventricular rate in atrial fibrillation. Hypertension control. Dihydropyridine CCBs are frequently used as antihypertensive agents to reduce blood pressure by dilating blood vessels. It's important to note that while calcium channel blockers are effective in treating specific conditions, they can have side effects and interactions with other medications, so they should be used under the guidance of a healthcare professional. The choice of a specific calcium channel blocker depends on the patient's condition and individual characteristics.